Hello, I'm Martine Walmsley and I'm Head of Research Strategy at PSC Support, and I'd like to tell you about some of the research work we've been doing recently. We announced that your donations are funding 3 new research studies totalling £140,000. 2 of these studies are tackling bile duct cancer. Although rare, people with PSC are at higher risk of getting it than the general population. One of the studies is building on previous research we funded to develop a blood test to detect who is at most risk of getting bile duct cancer and to detect it early. If successful, this would be groundbreaking and give those affected the chance to have early and more effective treatment. The other study is investigating how cells in people with PSC can develop into bile duct cancer over time. The insights about what is changing could pave the way for medicines to prevent early bile duct cancer forming into tumours. If successful, both studies have the potential to change the face of PSC as we know it by allowing people to get on with their lives without the worry of the ticking time bomb of bile duct cancer hanging over them. Our third research study is equally groundbreaking. Dr. Rushbrook is developing a blood test to diagnose PSC, building on research that PSC Support has already funded. What is most exciting about this research is that the unique molecule that will be used to diagnose PSC is a marker that might be responsible for activating the immune system in people with PSC. If he can unlock this critical knowledge, it will be the breakthrough that could pave the way to developing a drug to switch off the faulty immune response and stop PSC from progressing. We're a long way from that, but it's absolutely research that is taking advantage of cutting-edge technology and addressing some of the most important issues for people with PSC. Clinical trials and studies. So one of the trials, called Integris, announced some encouraging early results last month, and more results are expected next year. And if these results continue to be positive, we hope that the drug will be tested further in more people. The search for a treatment for PSC is moving forward thanks to people who take part in clinical trials, and if that's you, thank you. And if this is making you think about taking part in trials or finding out more about them, there are a number of clinical trials and studies looking for people to take part right now, with new ones coming soon. You can find out about the trials near you by looking on the PSC Support map on our website. 2 of the trials are testing drugs to reduce itch. And over the last few months, despite it being summer, it's been busy. We've presented to healthcare professionals at conferences and to a biotech that's thinking about developing a new treatment for PSC to help these researchers and scientists understand more about the enormity of the unmet need associated with PSC and the urgent need for better care and treatment. And finally, many of you have given your blood to the UK PSC Biobank. These samples have been used to advance our understanding of PSC genetics and in numerous other studies. Last month, more samples were released to a research team working on validating biomarkers for PSC. We'll follow progress closely and keep you updated. The results of some of our work has been published in scientific journals in the last few months. Highlights include the new guidelines for diagnosing and treating bile duct cancer, a protocol for allowing liver transplant for some bile duct cancers, yet this is still very early work, and the results of our PSC survey where over 900 patients told us about their care. We're very lucky to work with incredibly dedicated researchers and clinicians. There's certainly a great deal going on in all directions, and I hope you found this mini update interesting. Our work's only possible thanks to your generous fundraising and donations, so thank you. And if you'd like to know more about our research activities, go to our website and search for Mission 2030. Thank you very much for your attention.